Identify your patient with 2 patient identification, verify your provider order, and explain the procedure to the patient. You will need a tourniquet, a blood culture bottle, 2 alcohol pads, a chlorhexidine prep, gauze and tape, a discard blood tube, a butterfly needle, and a vacutainer. Indicate the desired volume of blood needed on the bottle by marking it on the bottle label. At least 8 to 10 milliliters of blood volume is optimal for an adult. Avoid using a tourniquet if possible, but if necessary, apply tourniquet appropriately and identify an appropriate site. Do not leave tourniquet on for more than a minute. If releasing a tourniquet, do not reapply for at least 2 minutes. Prep your supplies by removing the protective cap off of the culture bottle and disinfecting the septum with an alcohol swab. Leave wipe on top to protect from air contamination until right before use. With the other alcohol wipe, disinfect the rubber stopper of the discard tube. To prevent contamination, you may place the prep discard tube in the vacutainer. Attach the butterfly needle to the vacutainer carefully. Disinfect the intended puncture site with the chlorhexidine prep by scrubbing in a back and forth motion for 30 seconds, and let dry for 30 seconds. Apply tourniquet without contaminating the prep site. You may choose to grasp both wings of the butterfly needle with your thumb and index finger or hold the body of the device. Carefully remove the sheath covering the needle and puncture the site until you can observe a flashback of blood behind and below the safety button. Push the vacutainer holder to the discard tube and properly discard the blood amount. While you maintain the bottle in an upright position, push the vacutainer holder into the septum of the culture bottle and collect the blood to the marked level. Remove the bottle from the vacutainer holder and gently invert the bottle to mix the content. Release the tourniquet while maintaining the needle in the vein. Place the gauze over the site and activate the safety needle. Hold pressure to the site to stop the bleed and apply tape over the gauze if needed. Discard the butterfly needle and vacutainer carefully in the sharps container.